Healthcare Ready's mission is to serve as a facilitator and integrator and convener between the private sector, public sector, and nonprofit sectors. There are very few organizations that are set up to do that. There are very few organizations, importantly, that have the trust of all of those sectors. Through the many years of hard work and experience, Healthcare Ready has been able to position itself to be that convener, to be that trusted voice, to ensure that each of those sectors are not working cross paths, but working in a coordinated and integrated fashion to meet the needs of the vulnerable patient populations.
They're really thought leaders in emergency preparedness and in building health equity into our emergency responses. So I think it's important that policymakers and federal agencies be educated on the work that Healthcare Ready has done and is doing.
Healthcare Ready supports the public and private sectors in so many ways, including through the creation of essential tools and resources. For example, their RxOpen tool. This interactive map illustrates the current operating status of pharmacies and other healthcare facilities in areas impacted by disaster. This critical information helps responders and the public maintain continued access to care in times of dire need. When people might not know where to turn to for help, Healthcare Ready's tools and resources are there to help meet communities' needs. And Healthcare Ready is serving as an important connector across healthcare and partner sectors. There's a clear commitment to serving communities and the public.
Healthcare Ready has been in the room with national leaders during so many of our federal responses, speaks to how valuable the organization is. We really need Healthcare Ready at the table before a disaster strikes and during the response.
I think we need to recall and remember the history of this organization. It was stood up immediately following Katrina. And it was stood up for reasons whereby there were challenges and barriers to ensuring that medical products were being delivered. And so it's the role of an organization like Healthcare Ready is ever more critical in uncertain times, and serving as that voice, serving as that convener, serving as that collaborator and integrator across the sectors is critical.
Seize the moment. No one likes talking about disaster response, but this is the moment in time where it's important and people understand what we need to do. But it's a much broader ranging topic than I think anyone can imagine. So understanding how they can play a role in public-private partnerships and transparency in supply chains, Healthcare Ready is uniquely positioned to help us move into the next phase of a modern supply chain. For as much as they did during the response related to COVID and past hurricanes and wildfires and tornadoes, it's the work they have to do in between, in the downtime and the quiet time, to make sure that their voice is heard so that the industry knows that they're there and they're a resource for when things turn south.
As we reflect on the pandemic, there's an extraordinary opportunity to act upon lessons learned. Healthcare Ready is poised to play an important role in helping to tell the story and take action to implement these lessons. This work is imperative to modernize our healthcare delivery system to better tackle future public health challenges. We must maintain the accelerated innovations that have proven effective. Together, we can maintain the access to pharmacy care and other types of care Americans have come to know and trust during the pandemic. Healthcare Ready's renewed focus on health equity is critical as we look to the future. We have made great strides during the pandemic by expanding equitable access to care, and there's more work to be done. Healthcare Ready can help close this gap along with the nation's pharmacies and other stakeholders. I'm excited to partner on this important work moving forward.